Hi, my name is Megan Carey, and today I'm doing my case study on Crohn's disease. Crohn's disease is a chronic inflammatory bowel disease that affects the lining of the digestive tract. Crohn's disease can sometimes cause life-threatening complications. Crohn's disease can cause abdominal pain, diarrhea, weight loss, anemia, and fatigue. Some people may be symptom-free most of their lives, while others can have the severe chronic symptoms that never go away. Crohn's disease cannot be cured. Medications such as steroids and immunosuppressants are used to slow the progression of the disease. If these aren't effective, a patient may require surgery. Additionally, patients with Crohn's disease may need to receive regular screening for colorectal cancer due to increased risk. So for my case study, there was a 26-year-old Caucasian male presents to the emergency department with a chief complaint of abdominal pain. His symptoms began 2 days earlier with abdominal pain that is most likely diffuse but seems to be more intense in the right lower quadrant. He puts pain as an 8 on a scale of 1 to 10. He also has associated anorexia, nausea, vomiting, diarrhea, fatigue, weakness, and shortness of breath. The diarrhea is described as. Here are some radiographic images of Crohn's disease. On this side, you have the CT, and on this side, you have MRI. Watery, non-bloody, and occurring approximately 10 times per day. Without bowel incontinence, he describes the nausea as occasional with 2 episodes of vomiting that day. The patient has never had this type of pain or combination of symptoms before. This is a barium enema image of Crohn's disease. There's a severe stricture of a long segment of the terminal ileum. This is called the string sign of Cantor. This image also demonstrates another typical feature of long-standing Crohn's disease, that affected bowel loop seems to be separated from the normal small bowel. So for patient interaction, first I would introduce myself, then I would ask them some demographics like their age and date of birth. I would ask them if they have any allergies to medications. I would ask them their surgical history, and then I would explain the exam that I'm about to perform, and I would answer any questions that they have. So for Crohn's disease, treatments cannot cure it, but they can help most people live regular lives. Crohn's disease is mostly treated with medications including anti-inflammatory drugs, corticosteroids, immune system modifiers, antibiotics, drugs for diarrhea, and biological medication. In conclusion, Crohn's disease can be extremely painful for a patient. It is the radiologic technologist's responsibility to explain the upcoming procedure and answer all questions the patient may have. Patient safety and comfort is my #1 priority. Well, that concludes my case study today. Thank you so much for listening. I hope you enjoyed.